forces, and in particular the many doctors, nurses and other clinicians who serve in our military. The NHS was founded as part of the reconstruction of our country after the Second World War, and since it has grown into the most trusted organisation in the country. Along with our armed forces and other public service organisations, the NHS is a rock for people in times of uncertainty. And as we've all found our way through this global pandemic, I'm proud of the partnership that the NHS and our armed forces have forged to give people the help that they need. In constructing the Nightingales, our extra capacity to back up existing intensive care services, the Army and the NHS has worked hand in hand and achieved something quite extraordinary. And I know my colleagues working on the front line of the NHS have been extremely grateful for all the help that the military have offered government in the distribution of protective equipment. So today, as we celebrate the service and dedication of our armed forces personnel, I want to remind those serving in the military that the NHS repays your service with tailored care, whether that's physical rehabilitation or specialist mental health care, in particular to help veterans to make the transition into civilian life. While a growing number of veterans have been referred for help year on year, latest data indicates a drop in the number of people reaching out to specialist services in April. So for any military families watching today, remember that if you need medical help, as is the same for anybody who needs help, particularly emergency help, then please come to us in the NHS. I'd now like to move to the daily presentation of data slides. The first slide is a reminder that I won't go through in detail today because you have seen it many times before, of the 5 tests that the government has set for adjusting the lockdown. In the next slide, we have a slide, as is usual, looking at how the public have been complying with the social distancing instructions that we've all been given. This is data from Google, and it shows a 7-day rolling average of the mobility of the public in various places. And you will see when it comes to transport and retail and recreation and the workplace, there has been a dramatic reduction since the social distancing measures were introduced. A little bit of an uptick in workplaces, but I would remind you that people are clearly working in some workplaces, although many are working from home. One other thing to point out, in parks, you will see that there's a bit of variation in use of parks, which I'm sure is consistent with sunny weather and people going out a little bit more. In the next slide, we look at the daily tests. You've heard the data for yesterday, and you will see that there has been an increase in the number of tests at the end of April and into May. In the next slide, you will see how that testing capacity is reflected in new cases. You will see a steady number of new cases being reported, and these remember, are those individuals who test positive in the testing programme. But as the capacity has increased, that number has not increased dramatically, reflecting that the social distancing measures are being complied with, they're working, and overall the spread of this virus is reducing in the community. In the next slide, we show how that translates into those that unfortunately have to receive hospital care. And again, remember that for the majority of people, over 80%, this is a mild illness, a flu-like illness that you can stay at home with, but for some it does require hospital admission. And you will see that hospital admissions peaked and plateaued around the middle of April, and since they have been falling. Most obviously in London, where the number of cases was highest, but also maybe a little bit more slowly, but certainly in other parts of the UK. And there has now been quite a decrease in the number of people in hospital with COVID-19. And then for the sickest patients, in the next slide, you can see the usage of critical care beds for patients who have COVID-19. Again, a minority, but these are the sickest patients who require the most intensive care. This shows a proportion of beds, and you can see that that proportion has again been falling since the middle of April and is now down at below a third. And the absolute numbers of patients in critical care beds with COVID-19 is similarly falling. And then finally, we show data on deaths, and sadly, you will have just heard of another 626 deaths in all settings today. But you can also see from this slide that when looking at the 7-day rolling average, which means that we can correct for changes from day to day, there again is a decline in overall deaths that again has been occurring from the middle to end of April. And then last is the international comparison. This shows the UK, all settings now with a lag on it. Well, sorry, not with a lag on it, but UK all settings set from a particular start point for all countries. And again, the usual caveats that we give, that comparisons between different countries is difficult, and it will only be excess mortality, all-cause mortality over a period of time of the pandemic that will be probably the best way to make this sort of comparison. Thank you.
Thank you, Stephen. And we'll now turn to questions, starting with our first member.